Hello, my name is Dr. Donna Kinchlow. Some people call me Dr. Donna, and that's fine. I did spiritual care research back in 2017 when I got my doctorate. And I first want to tell you I'm very proud of you for choosing nursing. It's a wonderful thing, and it's a wonderful profession, and you'll never regret it. Today I get the privilege of giving you 20 to 30 minutes of an awful lot of exciting and maybe uncomfortable topics. So I entitled our session together as Flipping Fear to Calm: How to Address Spirituality, Loss, Grief, and Death in Our World That's So Full of Diversity. So if you want to, get yourself a cup of tea, a cup of coffee, iced water, lemon, whatever it is you prefer to drink, and let's just chat. As far as objectives, this looks like an awful lot. We're going to briefly talk about what it means to have well-being spiritually. Is spirituality and religion and faith and holistic well-being all interconnected? Let's give a little bit of time of wonderment to how illness actually touches people spiritually. We'll talk about the intent of what a nursing assessment is when you're talking about spiritual care. Of course, we can't go through life without nursing diagnoses and the nursing process. And of course, we'll jump into a little bit of stories about loss and grief and dying theory and the imminent stages of death and potential spiritual interventions for people who are about to cross over from this life to the next. Okay, so here you have it. There can be a fear of the word spiritual. Look at this poor woman. Oh man, I'm not religious. I don't want to go there. Yeah, oh. And you know, that's how some patients feel, some families feel, and that's how some nurses and healthcare workers feel as well, that it's a private, intimate thing, and they don't want to think about spiritual things. When we talk about being holistic, take a look at this. A patient is firstly a person. I'm not a series of medical bits and illnesses. Indeed, you should always be treated like the whole person. Well, years ago, we used to say to each other, you know, the gallbladder down in room 6 or the open heart surgery in 7. And you realize that we just cannot do that. And when you hear the word holistic, what does it mean? We are physical, we are emotional, we are spiritual. And many of your organizations will toot that as they have their advertisements on television, that we're going to take care of your body, your mind, and your spirit. Okay, that's well said. That's holistic care. We're going to take care of the physical and we're going to take care of the emotional and mental. And that's really big right now in our world. But people really don't know how to take care of the spiritual very well. And a lot of the regulatory bodies tell you, yes, you will teach it. Yes, you will do assessments, but we're not going to tell you how to do it. And so sometimes that just leaves a little bit of creativity, which for some of us is a lot of fun. So as you can see, here this guy is. The whole person includes not only the body, but the heart, the spirit, the soul, however you want to word it. So when people try to address spirituality and spiritual care, some people are going, oh man, how am I going to deliver the spiritual care? I don't even have any idea. I don't want to be involved. And the patient is looking at the nurse going, but you know what? You're already making a difference. You care about the person. And some of the staff is already doing spiritual things, but you really have to have an understanding. What are we talking about? It's really not the icing on the cake. It's mixed through the whole thing. So don't you love that? Raising awareness. And I do want to say, I did get permission from Graham Ogilvy Design from the United Kingdom to use his slides, which I just absolutely had a great time with this dear man. I sent him an email and told him how much I loved his slides and could I use them for PowerPoints. And he was like, I made his day. So complete this equation with me. Illness plus spirituality equals what? Do you think that it impacts a person's spirituality? Do you think that people think about spiritual things if they have acute, chronic, or terminal illness? I do believe that some people don't think about spiritual things unless they're getting ready to die. And I guess they believe your spirit pops out when you're getting ready to die. And the truth is, your spirit is within you all the time. It's right there with your heartbeat, and it's all through the cake. To really engage frontline troops, sometimes we need to modify our language. This is the chaplaincy, spirituality, your inner self. Oh, wow, some people just want to run. Here comes the God Squad. I'm not having any part of this. I will tell you that I experienced this when I did my spiritual care research. I went to different in-services about delivering spiritual care. And during one in-service, two techs jumped up and said, I'm not having any part of this. And out the door they bolted. Well, why did they do that? Because in their mind, their idea of spiritual care had to be something outside of what I was offering, but they didn't give me a chance. They didn't want to hear anything about spirituality. And some people are like that. They have an aversion to thinking about spiritual things. So when we talk about spiritual assessments, what in the world is an assessment? Well, when you come into my room and you're going to do a physical assessment on me, you're going to talk to me and make sure that I'm able to answer appropriately. You're going to listen to my lungs, you're going to listen to my heart and my belly sounds, and you're going to check my pulses. You're going to look at my skin color. You're going to do a good assessment. When you do a spiritual assessment, sometimes you need to realize that nonverbals and verbals are very important. Sometimes it'll be right there with what the person says to you. So if you did a spiritual assessment, some hospitals and organizations actually put that in your admission documentation. So you get into your computer and there may be some questions. Really, sometimes the registrar, who the minute the patient comes in, they will ask you, if you've ever been a patient, are you involved in a church? Would you like us to call your minister? What is your faith? Are you Protestant, Catholic, Muslim? They may ask you, and it may already be in the chart. And the other part of spirituality that is something that you'll be able to usually ask is in your admission, would you want a chaplain or a pastoral care consult? Which is something most nurses are able to do without a doctor's order. Because you see, some people would want that. Some dear people who are of the Catholic faith would want communion. Someone might want a rosary. Someone might want just prayer, regardless. And you have that ability to offer. Now, is that doing an assessment? Yes. And by putting in the order, are you actually meeting their needs? Yes, you are. It's not difficult if you know what resources you have available and what you can do to help dear ones. So you can find out, does a person have faith or do they lack faith? What fellowship or community support system, what kind of work do you do? What kind of things give you satisfaction in your life? You might run into someone who works very closely with rescue mission or community service, and it kind of gives you an idea about where they stand. And many people will tell you, that church is important or worship or synagogue is important. And again, an awful lot of your assessment requires you to talk to your patients, and you don't have to be afraid of it. If you truly have an area where you want to know, well, how could I actually ask an unthreatening, non-threatening question? My favorite is, are you a person of faith? That is not judgmental. That does not put you in a category. That does not help anybody start doing some kind of stereotyping. And I'm not asking what faith, but I'm asking if you have faith system. And of course, our nursing process, assessment, planning, implementation, evaluation, and never, never, never leave your brain at home. You will be utilizing critical thinking all throughout your assessments, physical, mental, and spiritual. So there are several assessment tools available. I could create a list for you if you are interested in that. You can Google that and you will see there are multiple spiritual assessment tools. Key element to obtaining an accurate spiritual assessment is careful listening. Okay, so here I'm giving you some examples of what a patient may say, and you may go, whoa, so that's what they say. What do I say to what they say, right? You need to be aware if a person says to you, oh, my life is meaningless. God has abandoned me. I miss my husband so much. He died 2 years ago. I want to die. I just want to run away. I truly have nothing to live for. These dear ones are expressing meaninglessness, hopelessness, and are oftentimes seeking help in their distress. Because you see, spiritual distress is one of the things that you're going to be able to identify. And in doing that, it's the nursing diagnosis related to spiritual health, spiritual distress. I don't have the ability to experience meaning in my life anymore. And my purpose in life, the things I used to love to do, I don't do anymore. Maybe you sing in the praise band. Maybe you are a nature lover and maybe you're an artist, but you just are doing nothing. They can become anxious, fearful, powerless. They can't cope anymore. Or they're at risk for spiritual distress, for maybe they've had a tremendous loss. So you might also see someone who has no peace in life and also may be angry. And let me tell you, after 44 years of being a nurse, you end up with a different kind of skin when people express themselves, and anger is something that people who are in spiritual distress have to express. And you may be the target, even though you really don't deserve it. I can remember a woman who just was so angry. She went on and on and on, and I just let her complain and yell and carry on. And I simply said to her, come on, just give it to me. Just give it to me. I can take it. I can take it. It's okay. And then next thing you know, she dissolves to tears. Sometimes we need to respond to the people who are in a distressed state with that calm, that you realize it's not personal, that you realize that inner peace that they normally are having is gone. Isolation, refusal to socialize, refusal to get out of the house. And again, these are scenarios where people may be having spiritual distress. And so that is a nursing diagnosis. And then what happens? Well, spirituality. So if you start talking about things of the spirit, or you ask people about their faith, you might have a response like this. This man's going, I'm only here to get my appendix, and you want to know about my faith or my belief. Am I going to die? What is this? And you go, whoa, whoa, because some people believe that that's where it belongs. If you're going to talk about spiritual things, you're only going to do it when I'm dying or when I'm terribly ill. But you're going to find that there are people who care about their faith care about the things that they do, whether they're in the hospital or not. True or false? Let's get into talking a little bit about death and dying. Do you believe that we receive more training getting a driver's license than we do about death and dying? I'll tell you a little story. My husband's parents are the sweetest people. They're both gone now. They both died at 96, so my husband's got the long life gene I always tease him about. But they wouldn't talk about death and dying. And they were in their late 80s, maybe early 90s, when their friends got killed by a train. And the train hit the car, killed the man instantly, and the wife laid in the ICU for several weeks. And when Alan's parents saw that, they began to talk about death and dying. And they got advance directives, and they let the children know, they let their two boys know what they wanted done. Because you see, up until that point, I guess death wasn't something that they actually had people in their lives die before? Absolutely, you know they did. But this was very intimate and very personal. It was their best friends that they'd had all their lives. And so it made a change, because you see, the truth is, we don't think about it. But as nurses, you're going to see it, and you're going to see it with every age group and every place you are. You're going to see it. Now, this is just Dr. Donna's take. Life and loss, sport, PhDs, pain, heartache, distress, and spirituality on steroids. And I say that loss can be characterized and defined by the dirty deeds of life. And what are the dirty deeds? Well, if you're married and you go through divorce, or maybe your parents go through a divorce and you're a child of divorce, divorce gives you loss, despair, death of loved ones, death of relationships it's a loss, disappointment, dysfunctional family systems, narcissistic families, disability. What if you know of a friend who went to war and came back without an arm or a leg? It's terribly hard. Or maybe someone you know or love or you're caring for is losing their cognitive ability and they can't think anymore. And here comes Alzheimer's disease and Parkinson's and dementia. You know, we're almost outliving our brains, it seems. And doubt. Is that a loss? Yes. If you lose self-confidence, if you lose your self-esteem, that's a loss. And things can lead to tremendous depression. So you see, loss can be an amazing thing. We all have experienced it. We will all through our life. You're never going to go through life without experiencing some type of loss. Well, what about grief? And what about mourning? If loss removes things and people and relationships and situations that we love, what does grief do? Grief is the emotional response to loss. And what about mourning? That is the outward expression of loss. And that's highly influenced by cultural norms. You know, I was raised by my grandparents because my parents did divorce when I was a kid. And they weren't supposed to cry. Men weren't supposed to cry. Guys aren't supposed to cry. You got to be manly. You got to stuff that feeling. No. One of the greatest things that you need to know about grief is feeling is healing. I have a dear friend who's writing a wonderful book about that. And we need to start realizing that grief is a part of our lives. So there's stages of grief. Kubler-Ross has been around a long time. Denial, people don't want to believe it. They don't want to believe it. Now, I have a girlfriend that worked in ER, and she told me the best example I'd ever heard of about denial. There were two guys. They were high on pot. They were racing down the road, and they got into a wreck, and the guy behind the wheel dies. The passenger ends up coming to ER, but they have to get him to a higher level of care. So they're packing this kid up, 16 years old, getting him ready for life flight, and he keeps saying, I need to know how my friend is. Is my friend okay? And my girlfriend, who worked in ER for years, said, you know, Donna, you can increase complications. If we would have told that kid that his best friend had died, it would have accentuated his complications. So what we said was, we're taking care of your friend. And then the weird part was the state police and the nurses and the hospital called the mother of the 16-year-old who had died and let her know as gingerly and kindly as they possibly could that her son had died in an accident and she needed to come to ER. And that mother said, my son's not dead. My son's not dead. I'm not coming to ER. And she didn't. She never went to the emergency room. That has got to be the greatest example of denial that I've ever seen in my life. Anger. What about anger? This story is a sad one. A woman, sweet lady, loved her husband, Georgie, and he was demented, and she was taking care of him. And she got diagnosed with cancer. She died within 2 weeks of her diagnosis, and when they brought her into the ER, of course, Georgie was with her. And you know you can be demented, but it was an amazing, horrible, sad situation that this demented man actually knew that his connection to reality had died. Shirley had died. And so he became so angry and so violent. They had to restrain him. They had to give him medicine. Anger and grief. And again, sometimes as healthcare professionals, we may be on the receiving end of people's anger, unjustified, but it's okay. We got to let them have their feelings. Bargaining. Oftentimes, bargaining can happen if you have a dear patient who, let's say, I've been diagnosed with cancer and I know I'm going to die, but I have a granddaughter who's going to get married, and oh Lord, could you please let me live long enough so that I can see my granddaughter married. And oftentimes that bargaining chip, that desire, that hope, oftentimes they'll live to that point. So people will bargain with God. God, if you could heal me, maybe I'll serve you. I'll do this for you. I'll do that for you. Bargaining. And depression, of course, comes. You and I know that in our world, we like control. We like to have a schedule. We like to cross the T's. We like to dot the I's. When you don't have control over things, especially your health, you can really get depressed, or you can just experience tremendous grief. And then there's acceptance. And do people reach acceptance? Many people do. Many people do. And the beauty of acceptance is then you're at peace. And a lot of people will say that, you know, I've already made peace with my maker. You're going to hear and see and learn through all the years that you work, and I hope it's 44 years like I did. Some of the most amazing people in your life are going to cross your path. Grief can make you sick. Grief is an individual's journey. It doesn't have a compass. It doesn't have a watch. And the truth about grief is you might have those stages and those stair steps, and you may spend a little time in denial and then get through and get into anger, and then you might drop back and go into denial again. And there is no time limit. Crazy things that people say to you, you know, oh, you should be over that by now. Yeah, you adjust. You don't get over grief. So death and dying, the spiritual work of dying. Have you ever heard of reminiscing? You know, if we reminisce, we think back into our lives. And there have been patients, I love it. They'll do a life review and they'll bring it with them when they come to the hospital. And you can take this life review and you see, oh, this is where he worked and this is his family and da 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 da. And they have it all lined out. And what is a life review and what is reminiscing and the power of that? If you're able to say, wow, I did this with my life. I had purpose and I did well. And it gives you the freedom of wow. And so a lot of times during the dying process, people remember, they reassess, they reconcile, they reunite. I remember a friend Bob, he was so happy he had cancer and he was so happy his brother was coming. He hadn't talked to his brother forever. And his brother was coming before he died to see him, and you might as well have given him a gold bar. You know, that was everything to Bob. So when death is imminent, it's a coming. You ain't stopping it. What mattered in life doesn't matter anymore. My overwhelming closets and the yarn and the baby outfits that I might want to make, or the knitted garments, or my husband wanting to mow the yard and do the weed eating and manicure and weed, and none of that matters when you're getting ready to be done with life. Material goods don't mean so much. If you're taking care of a patient, small talk, sometimes silence is good. Sometimes meaningful. They call it mindfulness and being present. And the greatest thing about that is maybe I just want you to hold my hand. If you've been my nurse and I love you, touching me, hey, it'd be all right with me. You always have to be careful with touch. It's not one of those things that you just touch everybody, because not everybody likes to be touched. But when you find out after working with somebody for 12 hours, I'm just saying 2 or 3 days in a row, you're like family. They're going to fold you in. They're going to love you. So silence is welcome. And, yeah, I could do my hair, but, just keep me clean and fresh. And if I'm a man, shave my face, because somebody might want to kiss me, and make sure that my mouth is clean. All those things, the kind things. That's a way you're actually taking care of somebody. So the goals of the person dying is, again, I had meaning in my life, and I want peace after death. And a lot of people search for that hope of life after death. Several religions believe in that. Spiritual needs and interventions. Loneliness and isolation. There are some hospitals that have a group of staff that says no one dies alone. And so they actually have people on call. And if there is a patient who has no one, guess what? They call those people in, and someone will be with that person so that they don't have to die alone. People have to be comforted. You don't want them having pain. There's nothing worse than that. You make sure that you call your pharmacist, you make sure that you call your docs, and you make sure these people have pain relief. In the days we live today, there is no reason someone should suffer in pain. And again, just letting people know how glad you are to know them. Kind words mean everything. And you need to let them talk about their feelings openly. And I know that for some people, that's really hard. But I want to tell you about my girlfriend, Lois. Lois had cancer. She was my next door neighbor, and I loved her to death, and she loved me. And we were both nurses. And oh, golly, she came to my house one day, and she said, Donna, you're the only one that lets me talk about death. She said, I know I'm going to die. For heaven's sakes, I'm a nurse. I'm dying. I know it. But you're the only one who lets me talk about it. Everybody else blocks it. Oh, I'm praying for you. You're not going to die. God's going to heal you. She said, they're crazy. But I can talk to you about dying. I can tell you my hopes and my dreams. I am hoping that I die in my sleep. I am praying to God that I have a peaceful, good death. And I'm just so glad that you let me talk about it, because you know too the truth. I'm dying. And so often You'll hear people need permission to go. And sometimes that's very true. They need permission to die. And the family will get to a point where they've seen them, and you can just let them know it's okay. Your mom, she knows where she's going. She's at peace. You may just need to tell her, it's okay, Mom. We love you. We're here. We're going to be fine. We're going to miss you, but we've loved you. You've been a great mom. And it's okay to go. And it's amazing how quick they'll go when they say that. Um, it's probably something I haven't done a whole lot of research on, but it's a lot of fun to know that there can be joy in people leaving. Identification and aid in relieving any spiritual pain. Now, as a nurse as old as I am, I want you to know that sometimes you're going to get some crazy last minute confessions. And you're going to have some dear ones who say to you, 80-some-year-old lady in ICU, Donna, do you think that God will forgive something I did when I was 17? Do you think he'll forgive me? That's where it's nice to know your religions. That's where it's nice to know this woman was a Christian. And if you know about the Christian faith is based upon God's love and forgiveness. And she had asked for forgiveness. And so I was able, as a Christian myself, and knowing the Christian faith, I was able to tell her, your sins have been held against you no more. And if you go into heaven and say, oh Lord, what about my sins? He'll say, what sin? They've been forgiven. You have been forgiven. As far as the east is from the west, which those two are never going to cross. Your sins are that far away. And God has a sea of forgetfulness to be remembered against you no more. And we do. We have memory. So sometimes people will tell you of things that they did, and you may want to go, I think I'll call the chaplain. Or if one of your dear patients who you've been with has established a great intimate relationship with you, and they say, would you pray for me? And you don't pray. You never want to just skirt out of that room in discomfort and go, nah, I'll call the chaplain. Because if they love you, it is better for you to say, I am so sorry, Miss Jones, but I'm not comfortable praying out loud. But I know, Susie Bell down the hall, one of my coworkers, she could come, or I could get the chaplain if you want. Or if you want to pray, I can be here while you do and kind of be with you while you pray. You never want to diminish that love that you will develop between your patient and you, because even asking you for prayer is an intimate moment that they trust you implicitly. You also can facilitate planning with a family. The truth about planning with a family, one day I had a man that I knew was going to die, and so I said to the older daughter, I don't know if you know anything about advance directives. And she did not know about advance directives. And so I told her, and I let her know, I believe your dad isn't going to make it. Now that woman was so grateful to me because she had to make plans, and here's why. This man was in his 70s or 80s, and he had remarried, and the woman that he was married to was a gambler. Who'd have thought? Who would have thought? 70 or 80 years old, going to the boat. She knew that she would run through her dad's money that quick. And so, as crazy as it is, that facilitating planning, did I tell her to take care of finance as well? But isn't that also a heart, intimate, caring, planning thing you need to do? That woman was so grateful. So grateful. And yeah, you know, as you do your job, you're going to be able to know when someone is dying. And I will tell you this, they're not able to assess it. And I know you know that. You know, I had a friend whose husband was just the dearest soul, and I begged him, please, would you go to hospice? I'm not ready for that, Donna. Oh my, I knew, but you are. And I try to explain, what is hospice? Hospice is actually help for the family as well as for the patient. They will come, they will help. The family isn't alone. Do you know that that friend of mine, he went home with his wife and he died that night. And she was alone and she didn't have any help. She didn't have a hospice. But you can't push people into making decisions. You can't, even though you know in your heart what might be right, you just have to let them live their life. Some of the things that you need to realize that are extremely important whenever it comes to grief, loss, spirituality is the importance of communication and knowing the right words and the wrong words to say. So, what words actually work are sometimes simple phrases and you don't have to elaborate, but it's so precious if you can say them. If I was in the hospital and my husband was dying in the bed and you came to me and said, Dr. Donna, I am here for you. I am here for you. Powerful. Simple. My heart breaks with yours. Or, my words are empty. I really don't know what to say. I am just so sorry. Now, I know that they'll say, I'm so sorry for your loss. But you know, I think television has totally taken all the meaning out of that phrase. So personally, I don't feel warm fuzzies. But if you simply be who you are, don't leave your personality at home and just say, you know, this is breaking my heart. Or you cry with the people. Or you say, is there anyone I can call for you? How can I help you? Let me tell you, when I did my research, I did spiritual care, and I had surveys that were done. And one day I was in with this dear man, and it was his mom, and she was over 100 years old, and she's laying in the bed, and we're getting ready to do surveys, and he was fine with wanting to help me with my spiritual care research. And all of a sudden, in flies this gorgeous nurse with dark, long hair down to here, gets out her stethoscope, slaps it on the little old lady's chest, never says a word to either one of us. The elderly son, who you know is in his 80s, because mom's over 100, and she runs out. And then she runs in with another beauty, dark-haired, long hair, hanging down. They both slapped their stethoscope on Mama's chest, saying nothing. Nothing. And I say to the dear old man, you know, John, it looks like your mom has crossed over to heaven, because he had shared with me she'd been a very active Methodist, she was a Christian, she'd worked in the church all her life, she played golf till she was 95. He and I had a rapport. And sure enough, that's what it was. And the girl said, please don't leave. We'll have paperwork for you. And we'll need to know what funeral home she's going to. Okay, well, I want to tell you, um, I was a little miffed because you see, it was 2 o'clock in the afternoon. That man hadn't had anything to eat or drink since breakfast, and it's 2 o'clock in the afternoon. Usually, when you have somebody who's dying that has an awful lot of family around, you can call down and get sandwiches and yogurts and fruits and juices, and no one had even offered him a drink of water. And they handled his mother's death so poorly. Why? What can you see about that story? No one communicated one thing to that poor man. I got the phone number of his wife. I got him a lunch tray. I got him water. I sat and I talked with him. He even said, I can do your research papers. And I said, this is not about my research papers today, John. And we chatted, and he told me all about his mom, and I let him talk. And I had a wooden cross that was part of my spiritual care toolkit, and I gave him one, and I said, John, you might want to put this in your pocket, and the next few days are going to be hard. And he had told me that he and his mom, he called her every day. I said, I know it's going to be hard because tomorrow at 5 o'clock, you're going to want to call your mom. And you might want to grab onto that cross and remember where she is and what life she's lived. And we just had the sweetest time, John and I. And then he said this, I want you to know, I think you were meant to be here. You got me through the hardest part. What did I do for John? I met his physical needs by getting him a drink and getting him some food, but I listened to the stories of his mom, who had just passed before our eyes, and those dear young girls who were working on an oncology unit didn't see him like I did. So when you think that spiritual care is something outside of your ability, you put that away. It is loving other people and meeting their needs, and sometimes listening and taking the time. And the man hugged me. He hugged me goodbye. So be real. Don't leave your personality at home. Now, there's a couple books that are really, really good. Don't Ask for the Dead Man's Golf Club is actually a book, and it talks about the right words to say. Don't bring up God or heaven unless the people do. Now, that came from Critical Incident Stress Debriefing and Management. It's a course I took after 9/11, and I want you to know that some people are going to be so mad at God for taking their loved one. Remember that, those stages? You don't want to say something about God if they're mad at him. It's not the time. But if they say something about God, that could open the door. You don't want to go, oh, I know how you feel. No, you don't. You don't know how people feel when someone they love is lost. And you never want to be crass. Well, you know what? This is all her fault. If only she hadn't been doing drugs for 20 years, she'd still be here. No, we can't say stuff. You might think that. Please don't say that. You can have another baby later. You're young. No. One of the best things I ever heard in my life about that, your baby's been loved all her life. And that's all I gotta say. If someone loses a baby and you're there, best words ever. Don't you think you spent enough time with that cold corpse? Because when people die, we let the family linger. We bring in food and drink, and they can sit with that body. Why? Well, the best thing I ever heard was, the spirit of that person has lived in that earth suit, and they love that earth suit, and they love that person, and they can stay in that room with those people. You never want to go in and go, hey, we got to clean this bed. I'm getting some admissions. We got to get you out of here. No. Some people need to stay as long as it takes because they are in grief. And you see, grief isn't just about the patient. It's also about the family. And no matter how long has gone when people have lost their loved ones, you never ever want to say to anybody, well, you should be over this by now. Guess what? We don't have some kind of timeline that says you can only grieve this long. Get over it. Buck up. That's what Grandma would say. Nah, we don't say that. Why? Because that journey of grief is a personal, intimate journey. And we can't say how you're going to be when it's you, and maybe it has been you, and you know the right things that people said to you. I asked a group of students once to write down for me some of the best things that were told at funerals. One of the guys wrote on his index card, it was beautiful. A man came up to him and said to him, I want you to know, I know you're in school, I know you're in college, but I want you to know that your grandma has studied for her final all her life, and I know she got an A. Meaning, I know she's in heaven. Ah, what a sweet thing to say. Sometimes we need to actually capture those sweet things so we can pass them on to each other and be good wordsmiths and sensitive. I really thank you for the opportunity to share some of these stories. I hope it's been helpful to you. I want you to know that there are some ground rules, whether it's grief, loss, death, dying. Always be respectful of one another. Try to have an understanding of what your clients or your patients believe and what their practices are. Always take time to listen. That is so important. That meaningful presence is what they call it. That attentive listening and the ability for you to show how much you care. You know, when I taught years ago, I had a wonderful saying on my wall. People don't care how much you know until they know how much you care. So don't only just learn and care about the physical and the emotional, but do care about the spiritual. It's nothing to be afraid of. It's more about loving kindness and compassion than anything. So if you ever need me, walkthehalls.com. You can ask your professor. I'm sure she would share with you any of my contact information. And I thank you, and I hope you have a great semester. Thanks again for the opportunity.